Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, to another episode of our show. Today, bringing you another really awesome guest involved in creating a better tomorrow for many people out there. Today, we have the honor of being joined by Linda Jiang, who is the head of strategy and government partnerships for healthcare at Lyft, the ride-sharing company, where she's responsible for accelerating the growth of their business, ultimately driving public sector strategy and partnering with various policymakers and regulators to bring access to the rideshare service to millions of people who need it for healthcare access, an extremely important topic that, we've only started recently getting into on the show. Previously, Linda was an early growth operator at various healthcare startups. She led strategy for Modern Fertility. A company was focused on disrupting fertility services with various at-home tests and digital tools. Also, she was the head of consumer marketing at Color Genomics, really interesting population scale cancer detection and care company. Linda began her career as a management consultant at PricewaterhouseCoopers with clients including academic medical centers, integrated health systems, medical device companies, as well as big box retailers. She also had a role in corporate strategy at Twitter. Linda holds a master's in public health as well as a bachelor's of science with a focus on neuroscience and behavioral biology from Emory University. A lot of really cool topics to get into today. We're honored to have her with us. Linda Jiang, thank you so much for taking the time to come on the show.
Thank you for that introduction. So nice to meet you today.
No, it's great meeting you. It's great having you on the show today, and I really look forward to recording this episode. Would love to, as we typically do, start things off by sort of handing things over to you for a little bit, just to further introduce yourself. Would like to just hear a little bit about your background story, a little bit of what set you on this intellectual path in terms of neuroscience, biology, and ultimately what got you focused in public health to begin with. Would love to hear a little bit more about you.
Yeah. So I've, to really just take a step back, I've always been very attracted to hard problems, and neuroscience has always been very attractive to me from an intellectual perspective. Now, I'll be honest, in my day-to-day, I'm not necessarily using neuroscience in my job here at Lyft, but it is very fun cocktail party conversation. And, on the neuroscience part of things, I just remember starting college and it was known as a notoriously challenging major, which attracted me to it. But also, if you think about the brain, it is kind of like this machine that controls and regulates your emotions, right? Your body activity, and so many everything kind of stems from the brain, right? So it was so interesting for me to dive into that. But ultimately, I was attracted to public health. As you mentioned, I went to Emory, and Emory actually is right next door to the CDC, the Center for Disease Control and Prevention.
Yep.
And Emory had a really great public health program. And so I majored in my, I guess, master's program in health policy and management, because I was really attracted to how do you solve healthcare problems at scale through policy changes, right? As well as through business management. And it could be, how do you advance health policies to improve maternal health, something that we work on today at Lyft. And also on the business side, right? How do you make smart decisions as a healthcare company or a healthcare division within a company to better improve people's health? And so that to me, it's something that is very relevant and what I use in my day-to-day job here at Lyft, and happy to dive into that further as well. But that's the educational background.
Awesome. Awesome. Yeah, I very much, as I was sort of looking through a lot of the stuff that you were involved in sort of in the pre-lift days, which I'd like to talk about a little bit, these two major themes keep coming back, right? Efficiency and access. And I would love, sort of, again, when you talk about scaling these healthcare problems, I was looking at some of the stuff that, you were working on at PwC in terms of, evaluating various hospital systems and seeing how, their supply chains were doing and some of the key takeaways that you came with at that time. Again, when you were looking, we're going to be getting into sort of distributed models and tech, but some key takeaways from your time sort of evaluating these major systems, healthcare systems, that you might be able to share with us while we have you today.
Yeah, I mean, it's a really like great question. And, and I think it's also a very fun career choice to start your career in management consulting. I think a lot of people have also made that similar career choice because it exposes you to a bunch of different, very challenging problems that are faced by different parts of, in my case, the healthcare sector, but in other people's cases, it could be, the auto sector or the tech sector, for instance. And what I really learned to appreciate was that these academic medical centers or these hospitals or these health systems, they all want to do what's best for the patients, right? They all want to be able to increase patient access and deliver high quality care. But at the same time, they're faced with these very real financial constraints, right? Be it funding for, certain programs or, if they're a nonprofit, other types of financial constraints. And so, for them, it's how do you, if you take a step back, right? How do you help them operate and how do you help them achieve their goals of patient access and quality care while also recognizing that gosh, like they're very concerned about operating costs. They're very concerned about labor costs. And as I take a step back and I look at the work that we're doing today, working with health systems and helping provide them with transportation, it is recognizing that we can help patients get to their care on time and for a fraction of a cost of perhaps a more expensive medical vehicle or if you think about the system cost, the cost to system if someone were to miss their medical appointment. So it really for me just took a step back, like understand there's access and there's financial, and how do you marry the two together in this very real reality of operating within our healthcare system.
Hmm. Hmm. And along those same lines, and then we'll get to Lyft in a minute. But another major part, what you've been involved in, as I mentioned in the bio, is sort of this digital health revolution, and
Yeah.
whether it was you working in on sort of on the fertility issue, and properly timing hormone treatments or whatever, at home diagnostics, obviously with the oncology work that we were doing at Color, these themes keep coming back. Healthcare at home, freedom to be independent, and then ultimately something we'll be talking a little later on, aging in place. Other learnings, again, from your time pre-lift, sort of in the digital health arena, that you took away at that point, and then we'll head over to Lyft.
Yeah, yeah. So as you mentioned, I worked at Color and Modern Fertility. Both were growth stage startups, and they were focused on making testing more accessible for the broader population. And in Color's case, right, it was a new, more novel technology that they had developed or improved upon from the traditional testing era, and making it so that something that was traditionally only available through a lab, for instance, or through your physician, making it more available to the broader population in more of a physician mediated, direct to consumer setting. And it was the same for modern fertility, right? Taking something that has traditionally been done by the lab course of the world and
Yep.
making it more accessible to the consumer by, they had a website that you're able to order the test, obviously physician approved. And what I learned from that is that people have the agency and they have the willingness to be able to learn about testing or new technologies or new ways to use things and to really think beyond kind of the constraints of our system, right? Something that was traditionally done in a lab or a doctor's office, and really appreciating that people like to have the agency to be able to do things in their own time and sometimes in the comfort of their own home. and that the traditional healthcare model, the way that it always has been, doesn't have to be the way forward, and that we can rethink the role of the consumer or the healthcare patient and make them more central to the overall healthcare experience.
Excellent. Excellent. And I appreciate you again laying the groundwork there. So, we have the themes of efficiency, we have access, we're merging them with technology, and as per your mission of solving major problems in healthcare at scale, here's a major problem. And I'd love for you to talk a little bit about, I looked at this 3.6 million number of people who miss healthcare appointments every year. This was a American Hospital Association number. I saw a 5.8 million number for the UC Davis did recently. Wherever that number falls, it's hundreds of billions of dollars of trouble. And we've done shows recently on themes like people that skip taking their pills. Hey, I'm not going to take my heart pill or my blood pressure pill, whatever. And the numbers that causes to the healthcare system. This is another major problem. And I'd love for you just to sort of dive into this number. Tell us a little bit about how this problem became and ultimately how this led to the genesis of what we now know as Lyft Healthcare.
Yeah, yeah, great question. And I'll segue into that by even segueing, why Lyft Healthcare was attractive to me. So prior to working at Lyft, I didn't realize that Lyft Healthcare was such a significant part of Lyft and such an important
Yeah.
part of Lyft. And I wanted to stay in health tech, but really wanted to impact access at scale, right? I think that the testing technology was really great and really interesting. But as I take a step back and I was like, what is really fundamental to people accessing care? They can't get the care that they need if they're not even able to get there, right?
Right.
And so for that reason, Lyft Healthcare was really attractive to me as a career choice. And we've heard a lot about, social determinants of health or
Sure.
social drivers of health, SDOHs. And I think it's nearly, impossible to overstate the importance of SDOHs on people's health.
Yeah.
But as you think about, the non-medical factors that can impact someone's health, right? There is transportation, there is food access, housing, social support services. And, from our vantage point, gosh, some of these can be hard to address, right? Housing insecurity, social support services, to some extent, food access, right?
Right.
But as a rideshare company, transportation is uniquely easy, right, for us to be able to address because we know that we have rideshare at scale across the country. And so, as we think about transportation insecurity in healthcare, a lot of the numbers that you had cited, around 6 million Americans annually, they can't get to their medical appointments because they don't have transportation, right? And it could be because they don't have a private vehicle. It could be because public transit options are not available to them. But as we think about these Americans who lack transportation options and you look at kind of their demographics, right? They're more likely to be elderly, because as you get older, you do give up the ability to drive, right?
Right.
Sometimes. Um, you might be lower income, for instance, right, because you might have less disposable income for a private vehicle. And it also impacts people with chronic conditions and
Right.
people with disabilities, and all of that further contributes to this problem of healthcare disparities and healthcare outcomes. And so as we think about the work that Lyft focuses on in this space, it really is around how do we move these populations and get them to their medical appointments. So we do quite a bit of work with people on Medicaid as well as those on Medicare Advantage. And increasingly so, we're also doing quite a bit of work with state programs that touch on the disabled and aging populations as well. And so I think, even as we take a step back, there is the missed appointments, which we talked about. And
Right.
then you think about the downstream impacts, right? Which is if you miss an appointment, it's not just that appointment that is missed. It can also lead to, the potential of high acuity care, right? If someone has a chronic disease, right, and they can't get to their appointment, maybe someone has diabetes, they are going to their primary care doctor for a regular checkup, but they don't make it there. Their health might be more likely to suffer because you might not catch, the blood sugar, let's just, the levels that might be out of range initially, and that can lead to further problems down the line. So we think about there's also the system cost of missing the appointment. And then the last place that I just want to say here is that, there is the medical aspect of it. And then we also think about transportation as a way to also access other social drivers of health.
Sure.
Because if you think about, if you don't have transportation, sure, you can get to your medical appointment, but, it also intensifies this issue of food insecurity. You're not able to get to the grocery store to get, healthy food that you need to further, better health outcomes. It can also, particularly for the Asian population, right? It can further increase social isolation, which we know is a real issue that as people get older, and it's a real issue they're facing, and it can also lead to poor health outcomes. So we think about transportation kind of on a twofold basis, the impact to your health, immediate, long term, but also the impact to other social drivers of health. So to kind of like pull all together, we think that, from our perspective, transportation should not be an afterthought in healthcare. We really believe that it should be the starting point to think about how to use this to access the different services that people need to improve their health.
Yeah, I'd love to drill down on each of those separately because again, it was, I have the Lyft app on my phone. I was
Yeah,
unaware
yeah,
of a lot of these services. So again, just for the audience, we're talking about so-called non-emergency medical transportation. So heart attack, you're in an ambulance. Traumatic event, you're in an ambulance. But we're talking about sort of the typical day-to-day requirements of going to primary care physician and back. Let it talk a little bit about because I know there's Lyft assisted, there's Lyft concierge that sort of fall in this non-emergency medical transportation category. And I was wondering if you could just talk a little bit about those services, and then if you can also just say a few words about how long Lyft healthcare has existed within the Lyft under the Lyft umbrella, and a little bit of what your role on a daily basis as strategy and government partnerships involves. I'm sure you're talking with insurance companies, with state governments. What does a typical day in the life of Linda Jiang look like?
No, that is
As you,
a fun question. Um, so I'll start with kind of like high level Lyft Healthcare. What are we doing in this space? And I'll talk a bit about my role. So Lyft Healthcare, actually, we have a pretty fun origin story. We entered the healthcare space in 2016, and this is actually a really fun story that probably not too many people know about. So here is an exclusive for this podcast. So
I want to
um,
scoop.
we do these regular fraud checks at Lyft. And doing these regular fraud checks, one of our wires got tripped that an organization in Utah, they seem to be ordering rides for people, right? We didn't know what the use case was, but they seem to be ordering rides, a ton of rides
Hmm.
in New York. And so, that didn't make sense to us. We're like, well, they're located in Utah, and so many rides were being ordered in New York using burner phones. And it actually turned out to be a transportation manager tapping into Lyft for healthcare rides. And so their organization was based in Utah, and they were ordering healthcare rides for patients in New York. And so that's how we discovered the wonderful world of healthcare transportation. And from there, it was really for us an undeniable product market fit, right? We think about Lyft as Lyft Inc. as a company. We are a purpose-driven company. And I think that's something that's very clear in the marketplace, right? Our mission is to improve people's lives with the world's best transportation. And Lyft Healthcare is such a natural extension of that, right? Because to improve people's lives, there is helping people lead healthier lives. And so as we dug into this space, it was very clear that this is an area that, has market potential, but also a very strong fit for our mission and our purpose as a company. And then for Lyft Healthcare, if you know someone who is getting a sponsored healthcare ride, be it through Medicaid, Medicare Advantage, or a health system, there's a very good chance that they're taking a Lyft healthcare ride to get to their medical appointment. So we are one of the largest transportation providers of, you said, non-emergency medical transportation. It is a mouthful. So NEMT providers in the space. And the way that we do it is we work with thousands of organizations in the healthcare ecosystem. And as we take a step back, right, like a big portion of that is Medicaid. And as we think about, who does not have access to a private vehicle
Right.
and needs to get to medical appointments, it's people on Medicaid and Medicare Advantage. And so on the Medicaid side of things, and this is part of my role, is my team, we work with state Medicaid agencies across the country to formally authorize Lyft Healthcare as a NEMT provider so that we
Mm.
can take people to medical appointments. And the background and context here is that, when Medicaid was established back in the 1960s, rideshare was not even a thought, right, in people's mind. Who would have known that decades from then, right, we would have these transportation network companies at scale taking people around, the town, the city, etc. And state Medicaid programs, they have established rules and policies, and in certain state statutes in place that govern how their Medicaid NEMT program runs. Now, this is going to get a
Okay.
little bit niche and a little bit wonky, right?
No, it's cool.
And so, as you think about a state, they may have certain regulations in place that are, from our purposes, might be a little bit arcane, right? It could be that back when the program was established, they required the drivers to read the odometer and then at the end of every trip, write down on a piece of paper. But that regulation is in place. And so we work with these state Medicaid agencies to really help them understand how Lyft Healthcare works at scale. And look, we may not have our drivers writing down, the trip mileage on a piece of paper, but we have a digital trip record and we keep record of these trips and we're able to share it with the state Medicaid agencies or transportation managers, et cetera. And
Got it.
so what we do, we have worked with 27 states, including DC, and it covers over 75% of the Medicaid population. They are now able to use Lyft to get to their medical appointments. And so we're incredibly excited about that. There's still a lot more work to be done in that space. And so um, to to frame it up, so when we work with the state, once the state authorizes us as a NEMT or a transportation provider saying, hey, rideshare, Lyft, you're good to go, you're greenlit to provide Medicaid patients with rides to their medical appointments, there are these, what we call them as transportation managers. And the transportation managers are responsible for coordinating all forms of transportation, from ambulance to wheelchair accessible vehicles to door-to-door rides, as well as taxi rides and rideshare rides for the patient. And
Mm.
so they really are one of our main customers. And typically what happens is, if I'm Jane, I'm on Medicaid, I need to go to, let's just say, my prenatal appointment.
Yep.
I will get the name of my transportation manager from my health plan. I will call up the transportation manager, and then that transportation manager will book me a Lyft ride if I'm appropriate for it, right? Like if I don't need to be in a wheelchair or I can walk independently by myself. And so then a Lyft ride will be booked on behalf of the patient. And this dovetails a little bit into the product in the sense that these transportation managers, we have a business to business product called Lyft Concierge. And so they are entering, they're asking Jane, what is your pickup address, your drop off address? Where are you going to your medical appointment? And so then a Lyft car will show up for Jane when she's ready to go to her medical appointment. So in that sense, it's really nice, right? Because we recognize that for the healthcare population, there's not a one size fits all approach. Some people may have the Lyft app. That's great. We love that. And some people may not have the Lyft app because they may not have a smartphone, or they have a smartphone and they don't have the Lyft app downloaded. And so, in those instances, we can send them text messages to let them know that a Lyft ride is coming.
Got it.
Or if they have a landline, we can give them a phone call to let them know that a Lyft is coming. So, our platform really allows these third-party organizations, transportation managers, health systems, etc., to book a ride on behalf of someone, and then for that car to show up when that person's ready for their medical appointment. So I'll pause here. I've said a lot.
No, no, it's awesome. I mean, and again, I love the way you've designed this amazing ecosystem. The fact that you're connecting, in the case of, the example of, the Medicaid systems, the different states. It's quite. I love you, because prepping for the show today, I actually watched you on a panel. This was a couple months ago. It was CMS panel on this very topic of chip maternal health. And, this is strangely enough, this topic of maternal mortality in the United States being on the rise, crazy enough. United States, that
Yeah.
shouldn't be happening. Um, and, this odd thing that, my wife had a less chance of dying during, childbirth than my daughter.
Yeah.
Can you just say about what you could tell us about sort of the chip maternal health stuff that's going on? Because again, Jane, you gave that case of Jane, and we don't think about it as much, but just getting to those prenatal appointments, um, is just so valuable in this whole, when it comes to life or death, in terms of childbearing. Can you just talk about that, Linda, a few minutes? I think it's an important example of what you're doing.
Yeah, yeah, it's great. And I'm impressed that you watched the panel. I love that you've really done your homework and your research. And to your point, unfortunately, our maternal mortality rate, it probably doesn't come as a surprise to us nerds in healthcare. It's at its highest level since probably the 1960s, right?
Yeah.
And as you think about an expectant mother, right? I've had two kids myself, and you're probably, if I'm remembering correctly, had to go somewhere in the order of 14 to
Yep.
20 prenatal visits, right?
I
And
drove.
that's crucial to the health of the mom, and it's also crucial to the health of the baby. Um, but we also know through studies that access to these essential services, they can vary significantly, right? By social economic status. They can vary significantly by people's access to transportation. And so, what we have done at Lyft is, through our work with state Medicaid agencies and transportation managers, we've made it easier for women to get to their prenatal visits and their medical appointments. We do have product innovation, something that we have called Flex Rides. And it's actually really cool, which is if someone is going to their medical appointment, we can set it up with a transportation manager such that when they're ready to go, they can click the link with the tap of a button and request a ride to get to their medical appointment. And it makes it easier in a sense that if you think about those 12 to 20 visits, you probably don't want to always have to call to request a ride. And so we're making it easier for women to get to their medical appointments that way. In addition to that, I'll just make two more points here. Is earlier this year we announced our collaboration with two very forward-thinking organizations, Baby Scripts and Quilted Health, and they're really transforming the prenatal care experience. And so
Cool.
what we did is we worked with them to provide sponsored or rides are free to the expectant mothers. And so these are rides using a product that we have called Lyft Pass, which basically shows up on their app, but the rides are free or sponsored, if you will. And we're studying, so we're in a process of this, we're studying how giving women access to rideshare can increase their adherence or their attendance at prenatal medical visits. And the results are forthcoming, but we've had a lot of really great anecdotes from mothers in the study saying that, gosh, before it was really stressful for them. They had to figure out, public transit routes or ask their family or friends to take them to their medical appointments. But with this, it gives them the freedom and the independence to get to their medical appointments when they need to. So really love hearing that qualitative aspect of it. And then I think also too, it highlights another kind of issue and challenge in this space, right? A lot
Mhm.
of the mothers in this study, they're actually on Medicaid. So they do have the NEMT benefit that's covered by their Medicaid programs, but there's a lack of awareness. of these benefit programs. And so, if we think about these women, yes, they could be technically getting rides to their medical appointments through their Medicaid benefit program, but they weren't aware of it. And it's not just the prenatal population. We've done a study that has shown that probably on the order of 25 to 30% of people on Medicaid and Medicare Advantage even know that they have transportation as benefit. And so, one key takeaway from all of this, at least for me and for our partners, is how can we increase awareness of the Medicaid NEMT benefit to women on Medicaid, because we know that Medicaid finances about 50% of births in this country. Is there something that we could do with health plans? Is there something that we can do with state Medicaid programs and our transportation managers to let them know, hey, you actually have these rides that are covered by your program, and you can use these to get to your medical appointments, and that leads to positive downstream impacts on your health and the baby's health. So that's certainly one takeaway from that. And then the other takeaway from, the work that we're doing in the maternal health space really, goes to my first point is because they're going to so many of these appointments, we've got to leverage technology to make it easier for them to request these rides, right? To make it so that they can request rides when they're ready, and it doesn't always require them planning 3 days, 7 days in advance.
Um, let's talk a little bit about some of the sort of the well-being adjacent services. And we talked a little bit about the social determinants of health before, and clearly, beyond the doctor visit, we have the pharmacy, lab testing, physical therapy, and it seems like Lyft Healthcare, your group has been really creating a lot of collaborations that are quite interesting, and go into which ones you want. I mean, there was obviously there's a really interesting one on the area of aging in Maricopa County in Arizona, which focused on vaccine appointments along some other transportation services. Another one that stood out was something called Common Courtesy, which again, not just the medical appointments, but grocery stores. This principle of food is medicine. We don't always think about. We did an episode actually with we got this Kennedy guy that just became a secretary of HHS. His brother runs a company that focuses on all these food deserts that we have in the country that we don't always think about it, but it's not always easy to get to
Yeah.
nutritious food, and so that and sort of the food as medicine component. Dive into these as you want, because I think each one is equally interesting, and I'd love to sort of profile that alongside sort of the traditional medical visit, because we don't always think of all the other things that come along, whether we call them adjacent, well-being adjacent, obviously social determinants, but please.
Yeah. Yeah. And it's really interesting because this is actually an area that we're seeing quite a bit of interest, recognition, and activity from different stakeholders, right? From health plans to government at all different levels, at the state level as well as the local level. And a couple of interesting things to highlight is at the state level, we've had a lot of very interesting conversations and partnership with states where it could be through the Medicaid HCBS, another acronym to throw at you, so Home and Community-Based Services Program.
Okay.
It could be state funded through these area agencies on aging, for instance.
Yep.
Um, or it could be, through social services. But essentially, states are finding that people do need a way of being able to get around their community. And so let's take, home and community-based services, for instance. There is this real emphasis in Medicaid to keep people in their homes as they age, right?
Right.
Instead of traditional institutionalized settings, people do want to age at home. In addition to that, there is the population of people who might be disabled, either physically or potentially intellectually, and they also want to be at home versus
Right.
an institutional setting. And so, in order to keep that individual at home, you think about the whole host of services that the
Right.
individual has to be able to access, right? It could be getting them around their community because social isolation's and a real problem for people who are aging, or it could be someone who we call it like the IDD population, right? The intellectually disabled population, and they need to be able to get to their jobs. And so, but they may not drive their own personal vehicle. And so, all that funding we're seeing from the states and a real interest with states, and we're working with states and their programs to get seniors around out and about in their community, get people to their jobs. It could be to job interviews,
Hmm.
or it just could be, getting them to their jobs in the morning and then getting them home when their shift ends. So that's one piece of it. And then, in a common courtesy example, we're also seeing a handful of these organizations come up where there is funding at the local city level, right? That gosh, the city of Atlanta recognizes the importance of also, getting seniors out and about in the community
Right.
and working with organizations like Common Courtesy to make sure that seniors can get to their friends and family, to make sure that they can get to grocery store, to make sure that they can go to, the church, for instance. And so we're seeing a lot of very interesting investment and pockets of activity. I do think that's certainly an area for us to keep an eye out on because there is a lot of variation that we're seeing in between states and how they're handling this type of approach. From, we've seen different models in Minnesota versus California and then even Tennessee, for instance. And then we're seeing a lot of very different activity at the city level as well.
Hmm. And just one other thing I just like to point out because again I didn't know this existed, but in addition to while we're on this theme of aging in place, in addition to getting seniors out and out of the social isolation to these different important parts of the sort of the healthcare hubs, you also go the opposite direction and it's there's this is Sutter a program with Sutter Health at Home where sort of Lyft Healthcare is helping to reinvigorate where it required sort of the house call. And I was wondering if you could just say a couple words about that as well because I think it's we would think about Lyft going out but hey, you're bringing people to the home as well.
Yes, yes, exactly. And we've had a number of partnerships working with getting clinicians to the home to help, see the patient at home. And we're actually also increasingly getting some interest and activity from states to do the same thing, right? It could be to get caregivers, and it doesn't have to be limited to the clinician, right? It could be getting caregivers to the person's home. And so that's certainly an area that we're seeing an area of interest, which is, all to this effect of how do you help people age in place and age better and not
Hmm.
necessarily move them to an institutionalized setting. And there are a whole host of services that could be delivered at home. The clinician space is really interesting, right? Because as you think about moving clinicians around, there is also that productivity element where, if you're making these house calls, you probably also don't want to spend the time looking for parking, particularly if you live in a more urban setting, like San Francisco, where I'm based and where Sutter is based. Parking can be a real challenge. So if you think about the efficiency that might be lost for the clinician, that's certainly an aspect that is appealing to the hospital, the health system. In addition, right, it does help with giving the physician a little bit of product just downtime back in between appointments, right? Where you can maybe catch up on your notes from the visit in the back of a Lyft versus stressing about entering the address of the next patient that you're going to see and trying to find parking there.
Really, really. You know, but while we're on the theme of again aging and social isolation, it was last year that the Surgeon General of the United States released this report on sort of the the healing effects of the social connection and community. I see what Lyft is creating is a very important piece of this. I also noticed that you were involved in an organization. I didn't mention this, the bio called the Foundation for Social Connection, which looks like it's doing a lot of research on this very topic, which I think we're learning more and more about each day on, how detrimental just loneliness can be. Not just that, well, as we age, of course, but but for all of us. Can you say a few words about this organization and a little bit about how it shapes your thinking in this space?
Yeah, yeah, it's a great question. It's so CISO, they're a fantastic organization, and we were really plugged into this coalition, gosh, a couple years ago. And there were a number of different organizations that contribute to this, but one of the things that we really took away from this organization is thinking about if we're really trying to decrease social isolation and helping people get out and about their community, we really want to make sure that Lyft, right, and Lyft Healthcare were truly accessible for anyone to use, and that it's easy to help people stay connected to their community. So one of the ways in which we that this has informed our thinking both through talking to members of the organization and also talking to our partners and talking to the people that we serve is one of the things that we notice for seniors in particular and some hard to reach populations is that they could really benefit from an extra connection point, right?
Okay.
And it could be that, maybe they have a hard time locating a rideshare vehicle in a parking lot. Sometimes I do too. And that's okay. Or, maybe you're at home and you have some bags that you have to carry, and maybe you're older and you just want to have a helping hand. And this has really informed our thinking in terms of what services do we want to build that's specific to people who are, aging at home or people who might need some extra connection. And you alluded to this earlier in our conversation, this thing that we built called Lyft Assisted. And this really is our door-to-door offering for our healthcare and health adjacent partners, where unlike a traditional Lyft vehicle, this driver for Lyft Assisted, of course, they do go through additional, educational modules to make sure that this is something they're truly opted into and invested in. But they do park the car and they'll go to the front door of the pickup location and they will help the person get into the car. They can help them with like physical belongings. They may offer a hand to assist them to get into the car, and vice versa, a drop off. And what we've noticed is it actually makes a different population more open to and more comfortable with rideshare. So going back to
Hmm.
social isolation, maybe you're a senior and you really want to use rideshare, but you might be nervous about how do you find your driver at the
Yep.
curb? How do you find your driver in, gosh, we know hospital parking lots and all that, right? But knowing that we have Lyft Assisted available makes that population more comfortable with using rideshare to get to their medical appointment or to get to, the grocery store, or to get around their community because someone is physically meeting them at the door. And if they need an extra hand, maybe to carry their groceries, or they need someone to help them with a walker, they do have their extra connection point and
Hmm.
assistance. And it's, something that we've thought a lot at Lyft is how can we take what we already offer, take what we know about the population that we serve, and bridge the gap between the two when it's reasonable and when we know that it's something that we can offer at scale.
Awesome. Yeah, on the website you talk about this story about this older adult that has lost access to transportation. In this particular case, my mother-in-law she just became a widow a couple months ago. Her spouse was the primary driver, so that resonated with me. And again, to see you building this network, and again for something that I didn't know existed until I started reading about you, is just it's so very elegant and. I'm I take my hat off to you and the team for what you put together here because it fills again at scale such an important need. Linda, what's coming up for 2025 that we should know about? I mean, I think I touched on a lot of the different parts of the business, but anything I missed that you want to mention or anything upcoming as we get towards the new year in terms of things you can mention in terms of new services, other publicly facing relationships, anything else that I didn't touch on or read about, please.
Yeah, yeah. I mean, we definitely have a lot of exciting things in the works. So I'm sure you'll be hearing more about that later. I think, as the work that we do, we're always really thinking about how do we enhance the patient experience. So I know that our product team, is hard at work at making the patient and the member experience better. And this goes back to our points around, we recognize that there's not a one size fits all approach to the patient experience in healthcare, right? Someone might be really digitally savvy and they're able to, get that Lyft integration, if you will, with the Lyft ride that has been ordered for that person through the transportation manager, and they're able to track in their Lyft app. And that's great. And that's awesome for that person. And we also recognize that there's a segment of the population who may not have a smartphone, may not have the Lyft app. So we're working on making that experience easier and better, right? How can we optimize the type of messages that we're sending to them via text message or IVR or phone calls so that they know what to expect, so that they make the connection that a Lyft is coming for them. And so we're always thinking about the patient experience from all different angles and how do we make it better and how do we make it easier for them. Um, I think that's one aspect of it. The other aspect of it, and I'm really, interested to see what direction this goes in, is around seniors. And we obviously do a lot of work with Medicare Advantage organizations, if you will. We call them the risk-bearing organizations, the primary care senior clinics of the world, where they really pay for transportation to get their own patients to their primary care offices and so that they can make it to their appointments in time. So I'm excited to see where that goes. And I'm
Mhm.
excited to see how that extends to outside of Medicare Advantage, right?
Right.
To thinking around just, there's departments of health, there's departments on aging, and is there some collaboration that,
Right.
we could do there at a state level? Because Medicare, and Medicaid to some extent, they're funding for the healthcare services of this population. The Department of Aging, in some extent, is thinking about, this aging population in a different aspect and,
Right.
helping them get around their communities. Is there some collaboration that we could do there between, these two different types of agencies and departments? Because we're all really caring for that same population.
Right. Yeah, and this sort of fits beautifully into, this concept of health span that we've been talking so much about on previous shows, and giving life to these years. Yeah, it's really again an amazing merging of these principles that you've spent your entire career on in terms of efficiency, in terms of access, bringing it together with technology. Really, really an awesome story. One last thing, I know we're coming up to the top of the hour, but one last thing I just wanted to touch on, and again, in spending time reading about you, Linda, aside from everything you've been up to, I also come to realize that you were like a world hula hooping champion. And I would love to just hear a couple of minutes about that story. If you still compete, are you teaching your world champion skills to your kids yet? What's going on the hula hooping front? And do you have to hula hoop at the Lyft offices?
Yeah, that is funny. This is a fun story. So I will say, I've always been competitive. And so when I was, gosh, probably like 6 or 7, a neighbor down the street was really great at hula hooping. And I was like, I want to be just as good at hula hooping. And so I, took the time to teach myself to hula hoop. And I'm proud to report that I can probably hula hoop up to 5 hula hoops for more than 3 hours at
Wow.
a time. Yeah. And I've won some, contests at the mall hula hooping, but now this is a fun activity that I like to do. If they have a hula hoop at the farmer's market, you can probably find me hula hooping. My girls are young, so they're probably not there yet. I've tried to teach my husband how to hula hoop, but he's been less successful.
I was never successful at that either. So
Yeah.
no, really, really cool story. Again, and I appreciate you sharing it all with us. I wish you and the team the best with this as you continue to expand and develop this service throughout the country. But really very impressive. Again, for everybody that is going to be listening to this episode of our show. Across the podcast networks, or who will be watching on our YouTube channel. Again, you've been spending time with Linda Jiang, Head of Strategy and Government Partnerships for Healthcare at Lyft, doing really amazing things to build these systems to bring their ride-shared service to millions of people across the country that need it for healthcare access. Linda, again, I want to thank you for taking the time out of your schedule to talk to us for a little while about what you're up to. Thank you for everything you do. And as we like to say on our show, So thanks for helping to create a better tomorrow for millions of people out there via what you do. Really an awesome story.
I love that. Thank you. And I enjoyed today's conversation. And I appreciate you doing all the research and the homework on Lyft.
Great having you. Great having you.